Good evening. We're going to give it a couple minutes so folks can get into the Zoom room, and welcome. Maybe not even a couple of minutes, maybe about 30 seconds, and then we'll get started. Well, good evening. My name is Judy Gardner, and I am the Executive Director for NAMI, Washtenaw County, and I want to welcome you this evening. We are pleased to be presenting the first of a three-part webinar series on navigating a mental health crisis. Tonight, we will be discussing what happens before a mental health crisis. And this series this evening is brought to you by the collaboration of NAMI Washtenaw County, Washtenaw County Community Mental Health, and Michigan Medicine. At this time, I would like to introduce our panelists. We're going to have Penny Acosta, a NAMI Washtenaw County panelist, Dr. Megan M. Julian, and Liz Spring from Community Mental Health. So a couple housekeeping rules this evening. I'd like for folks we're going to have a Q&A at the end of the session after everyone speaks. And we would like that you would submit your questions in the Q&A at the bottom. So if you take your cursor down to the bottom and you'll see Q&A, submit your questions there. And if you want your questions to be submitted specifically for one of our panelists, please add their name. Also, you don't have to hurry and write notes down tonight, because we will provide you, if you've logged on today and registered, you will receive an email with a link to the recording, slides, and resources following this webinar. So now, without further ado, we will get started, and we will get started with our first panelist, who is Penny Acosta. Thank you, Penny.
Hello, everybody. So my purpose of being a speaker is to talk about warning signs before a crisis. Problem is, you don't know the warning signs if you've never been in a crisis. So I'm going to tell you about the signs that I had experienced, and after it happens one time, then you will notice warning signs in the future before the crisis, because you will have experienced them. So I'm going to talk about my son, Cristobal. And if I look way back, I can tell you I remember when he was 5 years old and he experienced night terrors a couple times. That was really shocking. Those are when you're actually still sleeping, and you're not just sleepwalking, you're sleep running and screaming, and it's pretty shocking. So it happened a couple times when he was like 5 years old, but it didn't happen after that. So I just thought, you don't know, you just figure it's part of him growing up. And then there was another time we went to the circus. He had the strangest reaction to one of the volunteers. It wasn't a clown, but it was someone kind of dressed up, and he would look at them like he's in shock. I couldn't talk to him. He's just staring. I mean, I couldn't understand him. He scared me for a minute. So that's when he was 5. You're not going to really recognize anything then, because how would you? How would you know? I didn't know. So then fast forward to him being 13 years old. First indication something was really not quite right. We took a trip to Yellowstone. So when we went to Yellowstone, I remember his father giving him explicit instructions not to follow me into this drugstore, Wall Drugs, if you've ever heard of Wall Drugs. Don't follow your mother in there. And he made it very clear. So he gets out and follows me in there as if he heard nothing. And his dad got really, really mad. And that's not the first time that happened, but his dad got really, really mad. So back home in school, he did things like, and at home, we went to Big Boys, and he wanted to order this and this and this and this. And I told him, you can't get all those things. for one thing, it's too much. I said, just order a few things. He heard me and he ordered everything again. So there's some confusion going on here. Something wasn't quite right, but there's no way for me to possibly know what it is. Now we're in high school. High school or middle school, he's about 14 years old. And I didn't recognize the weight loss. He had lost 5 pounds a month for 3 months. And he was a skinny kid. And I didn't notice the weight loss. He had baggy pants. He talked a lot to the lunch lady at school. So he wasn't eating. He was talking to the lunch lady. I started seeing things that didn't make sense. Like he told me he was communicating with our neighbor through our satellite dish. The neighbor doesn't have a satellite dish. That's when they had those 12-foot satellite dishes. So that really worried me. And then he comes home one day from school and he had some science experiment where he's using electricity and now he's charged and he's going to put electrical fence across the front door so the cat can't get out. All of these things are bizarre behavior. So this is before a crisis, not knowing I knew something's not right. So I just felt that if the school calls me, then I know that it's confirmed. So the next day, the school calls me. So it was confirmed. So what I did was I took him to the doctor and I made sure that they ran a blood test, which he fainted from because he was so skinny. It's when the doctor told me he lost all this weight. And just to rule out anything, I thought somebody put something in his drink. I mean, I hoped. Deep down, I just knew that wasn't it. So it turned out that he was just fine in the blood work. And I was told to take him to a psychiatrist. So this is where it begins. I took him to a psychiatrist. The psychiatrist prescribed Haldol and told me that he's psychotic, and I just can't wrap my head around that. So I decided to get a second opinion, and I went to U of M and I paid out of pocket for 2 psychiatrists, and they interviewed him and questioned him for at least 2 hours, but they came up with the same conclusion. So I had to realize that my son has a mental illness. And the good thing about Cristobal is that he's really very easy for me because he'll do what I ask him to do. So he's never done any drug abuse or drinking. So from that point on, the important thing is that it was early intervention. Took him to the psychiatrist. I didn't like him at all. In fact, we switched to a different one, which I liked much better. This is back in 1995. Back then, Cristobal was hospitalized 6 times. It wasn't a problem. He went to St. Joe Hospital every single time. There was no lack of beds, no lack of psychiatrists. And I will say they took really good care of him. And each time he got better. He even went to the crisis center after one hospital visit for a couple of weeks. He wasn't ready to come home. One time he was at Huron Oaks outpatient when he was still in high school in 1995. He was 15 years old then. So that was actually not even realizing that was, if you can call it easy, was an easier time. I even had one of the psychiatrists help me fill out forms to get him on Social Security disability. And he was not denied on the first time. So it's important to document everything that you see that happens, every medication that they're on. And I've documented all of his school reports when he was a kid and they thought that there was something wrong, his IEPs. but he did not find that he had a problem, actually, a learning disability. It just turned out to be a mental illness. He was very disruptive in school, but we got him on track. He's, like I said, he's pretty good about letting me take control, and got him on medication. So now I know what his crisis would look like. And so what I look for is too much energy. First thing, lack of sleep. So if he is not sleeping, then that's the first warning sign. Too much energy, which is the mania kicking in. Like he said to me one time, all of a sudden, I can see so clear. I don't need my contact lenses. Oh, that was, then I knew, because he had said that in the past. So it had happened again. Then I knew I'm getting warning signs, which gives me a 2-day at the most leeway to start getting him treatment or looking at his treatment. And he'll say something like he'll feel some zips or zaps coming from his head. You know, I mean, he really is feeling something. I don't know if it's just too much dopamine or the electrical current or what, but then he was helping other people with money. If they needed money, he'd give it to them. And he was hypomanic. Although Cristobal doesn't do hypomania, that was his step up to full-blown mania. That's what happens with him, and then becomes psychotic. So since he'd been hospitalized 6 times, I know this. So I know how to prevent, or at least recognize, a crisis possibly coming. And you will too, but you can't recognize it until you've been through it. So unfortunately, that's what it takes, but it does make you better at it. And I am really, I always tell him I'm Dr. Mom. So he's 41 years old now. He's actually, he's gonna be a speaker. He's working for community mental health. He's a good kid. So with that, I am going to pass it on to Dr. Julian.
Hi, so I think Kat's going to be sharing my slides. So my name is Megan Julian, and I'm a clinical and developmental psychologist and a clinical assistant professor at the University of Michigan. I'm going to be talking today about the warning signs and behaviors that might be observed before a crisis, and what to do to support someone before a crisis. So next slide. Mental health problems in general are really, really common. So 1 in 5 US adults experiences mental illness each year. And this includes things like anxiety, depression, trauma and stress-related disorders, psychosis, substance abuse, all kinds of different things. And these numbers have only climbed in recent times in the context of the COVID-19 pandemic. So some reports are actually suggesting that as many as 2 in 5 people are experiencing clinical levels of symptoms now. A 2018 report suggested that 4.3% of adults had thought seriously about suicide, and that has actually climbed to nearly 11% in the first few months of the pandemic. Next slide. So often there are warning signs that someone might be experiencing a decline in their mental health. So for older children, teens, and adults, you might notice things like a change in mood, more sadness, maybe more irritability, maybe a really excited and happy feeling that's not characteristic for them. You might notice poor personal hygiene, a change in sleep habits or eating habits. And this could be in both directions. So someone might be sleeping more or sleeping less, or eating more or eating less. So really you're looking for a change there. You might also notice that they're not participating in their usual activities anymore, or they might express that things that used to be fun just don't seem enjoyable anymore. Some individuals engage in self-harm or express thoughts about suicide. And some people experience overwhelming fear or worries that interfere with their daily activities. Some people might not leave the house for a long period of time, or their use of alcohol or drugs might become excessive. You might also see out of control or risk-taking behavior. And you might see something like extreme difficulty concentrating or staying still. Next slide. So a lot of my own expertise is working with younger children, and children as young as infants and toddlers can experience mental health challenges, but they often aren't able to verbalize their internal experiences in the same way as adults are. Mental health problems are very treatable in early childhood, and early treatment can set children up for better mental health as they grow older. So some of the common signs of mental health problems in younger children include things like irritability, frequent crying and temper tantrums. They might be less interested in play or other things that they used to enjoy. Physical aggression is really, really common. You might also see controlling or bossy behavior. They might resist support from trusted adults, or in some cases, when you give them support, that seems to escalate their distress. Some kids have significant difficulty with transitions, and others might show excessively rigid behavior. So like needing something to be done exactly the same way every time. And this typically goes beyond the realm of kind of young kids just liking routines. This is kind of to an extreme level. You might also see things like challenges with or regressions in their skills. So their language skills, motor skills, and toileting skills might either stall or actually go backwards. They might also experience sleep problems, pick at their skin, scabs, and hair. And one other that's I don't think listed on here, you might notice with younger kids kind of having a significant difficulty separating from their parents or other people that they find supportive. Next slide, please. So given how common mental health challenges are, most of us likely do know someone who is struggling with their mental health. And before it gets to a point of crisis, there are a number of things that you can do to help. So one of the most important things to do is to convey empathy. Conveying empathy means really trying to see things from the other person's perspective. It doesn't mean that we agree with their perspective, but that we're trying to imagine what it feels like in their shoes. So just listening quietly without trying to problem solve can be therapeutic in that it shows that it shows the person who's struggling that you're on your side and that you care about them. Mental health challenges can be really scary, but even serious mental health problems are treatable, and it's important to demonstrate the hope that things will improve. Even in the context of challenging behaviors, it's important to try to resist criticizing the person and try to remind yourself that they're trying their best with the tools that they have. It might just be that the tools that they have aren't quite sufficient. Sometimes a shift in our own mindset can help us to get to a place of empathy with someone who's struggling. So for example, when people show challenging behaviors, we might have thoughts like, why is he doing this to me? So trying to shift that to a thought like, what does he need from me? Can help you to be non-judgmental, to put yourself in their position, and to sit with their emotions. So it's not about making their feelings go away. It's about connecting with what it must be like to feel the way that they do. A lot of mental health problems are rooted in stressful and traumatic experiences. So when we think of their behaviors and feelings as likely a product of their past experiences, we can shift from thinking, what's wrong with you, to thinking, what has happened to you? And with that as our focus, we become more curious. We listen more, we judge less, and we respond more sensitively. Next slide, please. Another key thing to focus on before a crisis is enhancing the individual's social connections. Social relationships are one of the primary drivers of resilience. So you can check in with the individual and offer them support. And even just spending time together doing things that are enjoyable or relaxing can be really helpful. So some people might be open to talking about what's bothering them, but social support is really helpful even if the person doesn't want to talk about what's going on. Social support can also come from larger groups like families, community groups, cultural groups, or spiritual communities. So connecting people to groups like this, where they might be able to feel a sense of belonging, can also be really helpful. One important tool that you can utilize to try to avoid a crisis from emerging is a safety plan. So a safety plan is basically a plan that helps you to know what to do when things might be heading towards a crisis. Safety plans are typically done in collaboration with a mental health provider, but you can kind of work on some of these steps even before you get connected to a provider. So the first step of a safety plan is usually to identify and write down what some of the warning signs are for that specific individual that a crisis might be emerging. So it could be certain thoughts that they have, images, moods, certain situations that tend to bring about those feelings, or behaviors that they show when they're kind of on their way to a crisis. The next step would be to think about internal coping strategies that you can do to take their mind off the problem. So it might be something like relaxation techniques, physical activity, art, or any kind of distraction. And you'll also think about people or social settings that could provide a distraction from the problem. If those things don't work, the next step would be moving to people who they could ask for help, and then professionals or agencies that you can contact during a crisis. And you can find templates online that can guide you through each of these steps. So if this is something that feels like it would be helpful for someone in your life, if you just do a quick Google search for a safety plan, you'll find lots of good templates out there. And lastly, we know that people who don't have their basic needs met are more likely to experience mental health problems. So it can be really critical to ensure that their needs are being met with regard to things like housing and food and medical care and childcare. It's also helpful to encourage the person to engage in treatment, and again, to instill that hope that mental health conditions are treatable both with therapy and with medications. There are therapists and programs that specialize in all ages from infancy to older adults and with all different types of mental health challenges. So no matter what problem you're facing, there are providers who can help. Navigating the world of mental health treatment options can be really overwhelming. So if the person who's struggling is not yet connected to a therapist or a treatment program and is open to help in finding one, that kind of tangible support and connecting them to treatment can be incredibly helpful. So thank you guys for listening. And next we'll be hearing from Liz Spring from Washtenaw County Community Mental Health.
Thank you, Dr. Julian. Good evening, everybody. My name is Elizabeth Spring Nichols, and I am with Washtenaw County Community Mental Health, and I oversee the Youth and Family Services Program. I also want to remind you to put your questions in the chat, because after I talk about early intervention and brain development, we are going to get to our Q&A section. Next slide. So prevention is something that I love to talk about. It's extremely important. 50% of all lifetime cases of mental illness begin by the age of 14. And without treatment, there can be measurable changes in key areas of the brain affecting healthy growth and development. So with this can come increases in risky behaviors such as truancy, substance use. You could have a drop in grades, functioning, school dropout, and legal consequences. Next slide. So I'll touch a little more on prevention, talk about the brain development, a little bit on early warning signs. Dr. Julian covered many of those, so I won't double those for you. And then I'll talk about how and where to get help in Washtenaw County. Next slide. Mental health concerns start early. So we're seeing anxiety disorders for 6-year-olds, behavioral disorders, 11-year-olds, mood disorders, 13-year-olds, and substance use disorders start around the age of 15. So I will say we see mental health disorders much earlier than that as well, but most commonly, this is where things start to be noticeable in school. So early and accurate diagnoses and intervention, it not only improves the immediate outcomes, but it can also improve lifelong projections for individuals with a range of mental health problems. So the earlier you begin to address the child's behavioral changes and provide the needed support, the greater the impact. Additionally, how severe an illness is often is related to how early the symptoms show, as well as how early the interventions occur. Next slide. So this is a diagram of a brain with functional magnetic imaging of an individual that was 5 years old, and they followed this person until the age of 20. So the brain develops in a predictable pattern from the back to the front through the age of 25. So there are critical areas of understanding youth behaviors of the brain. So if you understand the limbic system, this is at the back of the brain, and it regulates emotions, reduces perceptions of risk and danger, and can also lead to more of that impulsive behavior. And then this area of the brain develops much faster than the frontal lobe, which is the area of the brain that is responsible for organizing, planning, and judgment. So adolescence is really a critical time in brain development, and some psychiatric illnesses can impact the brain in a permanent way if they're left untreated. And early interventions affects long-term outcomes. Therefore, if adolescents are having symptoms, they should seek help as soon as possible. Next slide. So I broke this down. I won't read every single one of them, but as you can see, we have younger, older pre-adolescent children, adolescents, and young adults. And so in younger children, we will see things, it's not all of these symptoms or one of them. It's a clustering of symptoms. For example, you might see a change in school performance, excessive worry with disobedient behavior or temper tantrums. That would be what you'd see in younger children. For older children, more getting excessive complaints, more physical ailments, defiance with authority, sometimes vandalism, and just a lot of irritability and frequent outbursts of anger. And if you get to adolescents and young adults, things become to seem more dramatic because these are the things that started early. The illness usually starts much earlier than, adolescents and young adults. So the symptoms become more severe. So adolescents, one of the things that they may experience typically as part of normal development is moodiness. So we don't want to pathologize normalcy. There's always that key when you're talking about early intervention and through the development of somebody through these stages of how the brain is development, like what is normal behavior and what is actually a time to be concerned, like Penny had mentioned. So when adolescents so I'll give you an example about the moodiness. So, however, if somebody is moody and that is dominant with displayed sadness, irritability, excessive crying, and that corresponds with behavioral changes, then it's time to seek treatment from a professional. So when adolescents do not receive treatment, when adolescents and children do receive treatment, they tend to get better. Additionally, their brain is more flexible because of the plasticity early on, and they can get the help that they need. So the other thing about adolescents is they are with that risk-taking behavior that they have, this may be a time to utilize that to the advantage because many times youth are more likely to take the risk with treatment. Based on the wiring of the brain, this can help them get better faster. Next slide. So I wanted to say, just overview, mental illnesses are common in all populations. Early recognition and treatment is essential. There's a lot of stigma that prevents many people from seeking treatment. Way too many people suffer in silence. And although 1 in 5 adolescents has a diagnosable mental illness, only about 1/3 of them actually receive treatment. And this was pre-COVID. So I also want to say that most families are not prepared to cope when they learn that their loved ones has a mental illness. That's why NAMI is such a great organization, because it can help families. I want to also mention that while we really want people to get help early, and early intervention is very important, I don't want to discourage people and think, it's hopeless, because brain develops throughout the lifetime, and there's much more plasticity than what we ever realized before. So regardless of age, treatment is available and it can be life-changing. So the most important thing that we can do is recognize the early signs of mental illness and help those in need get connected with the services. If you think that you or someone you know has a mental illness or emotional problem, it's important to remember there is hope and there is help. So I encourage you to raise awareness and get help if you need it. So I thank you so much for your time. And now we are going to go to our Q&A.
Wow, thank you so much. Thank you to the panelists that came to share with us today and participate. I want to remind everyone to please populate the Q&A for those questions that you may have for our panelists tonight. But before we go into the Q&A session, I just want to speak a little bit about NAMI Washtenaw County and the services that we provide. I came to NAMI about 12 years ago because I had a loved one who was experiencing a lot of what Liz was speaking about earlier. And I really didn't know what to do. And a colleague suggested that I seek out the education from NAMI. And here I am today. It's just phenomenal education programs. And so what we offer education, support, and advocacy. And we also do some community outreach that we've added to what we do as an organization. This is a wonderful organization. All of our education programs and groups are of no charge, of no fee to those who participate. We have family education, as Liz spoke about. A lot of families do not really understand what a mental health condition looks like. They're afraid when they're in crisis, and this is an awesome opportunity to be educated in a private setting with other people who are experiencing what you're experiencing. We also have peer education for those who live with a mental health disorder, and we also offer support groups for young adults, adults who live with, and also families and folks who live in support of someone that they love. So all of this information is available on our website. That is namiwc.org. So I just wanted to add that for tonight's discussion. Remember, all this is recorded, so you will have this information for later reference. So I will start the Q&A session at this time, and let me look and see what we have. I will direct the first question that I will ask to Dr. Julian, and the question is coming from someone. They want to know, at what age can you actually diagnose?
Yeah, that's a great question. I think there's a lot of people that aren't quite sure if mental health problems are real in early childhood. They are, I can tell you that. I work at a clinic where we treat kids all under 6 years old. And it's very common for us to give diagnoses that, they're appropriate, they fit the problem, even for toddlers and infants. It is obviously more rare at those ages, but we absolutely can diagnose very early. No age is too young. I will say not all providers are trained in diagnosing very young. So if you have a child that's really young and experiencing mental health problems, make sure that you're seeking out a program or a provider who has specific early childhood training.
All right, thank you, doctor. The next question, how do you get teens to participate in treatment when they are resistant? And I might like to defer that question to Liz.
Yes, so we have, we do a lot of engagement, a lot of motivational interviewing to try to help teens really meet them where they're at and not use any clinical jargon. The team that I work with of therapists and social workers are very engaging, and they're very entertaining, and kids really seem to like them a lot, and they're very good with adolescents. So just, being honest and just, meeting them where they're at and just having a genuine conversation, just showing compassion and that you care.
Absolutely. Thank you, Liz.
And I can add a little bit more too. One other suggestion that I have, if you have a child who, particularly a teen who's not willing to even show up to that appointment to talk to anybody, my recommendation would be, as the parent, to get support for yourself. So you can engage in kind of those peer-to-peer programs that Judy was talking about. You can also work with a therapist yourself, particularly with anxiety. There are actually some really good evidence-based programs where you can treat the child's anxiety just working with the parent. So it's not the end of the road if your child won't show up. There are other options.
That's excellent. That makes sense. That's a good one. Thank you. Let's see. Are the warning signs for adults the same as young adults? I would like to defer to the doctor again, Dr. Julian.
That's a good question. And, I think once you get to kind of teenage through adult, the differences in warning signs are more individualized than based on age. So different people are going to be showing different types of warning signs, and it's not quite as age dependent at that point. So you'll want to think about the particular individual that you're picturing, and what the things you notice when they're having a little bit harder of a time. Could be different for different people, but not necessarily age dependent at that point.
Okay. Thank you. This is a question I'm going to pose. I think maybe Liz or Penny can chime in. The question comes in as, if a child is having temper tantrums in first grade, how can you tell the difference in the willfulness versus mental health? So how do you know if this is just, a personality or if it's a mental health issue? Liz, you want to start?
Oh yeah, I was going to say Penny explained it so well.
She did wonderful with
just
explaining
follow
that.
up. So yes.
Penny?
The only thing I can say is, yes, kids do have temper tantrums, but they do, if they're doing something else that kind of raises your hackles, is not quite right, that's when you may have an issue. They all have temper tantrums, and there's a lot of things that they have in common with other kids. But then there's something else, you get this question in your mind, like, he doesn't make sense, or other kids are reacting to him in an odd way. Some of it is instinct, and we don't want to ignore it, but we tend to do that.
Yeah, I would agree with that. And it is, if they're only having temper tantrums, it's never only just one thing. There's always something else. And if you watch and, have conversations with your kid and observe them, you'll start to see other things too.
Yeah, the other kind of dividing line I usually go for as well, trying to figure out if something is kind of a clinical problem or not, is how much it's getting in the way of everyday life. So if you feel like they're having temper tantrums, but you can get them to school, you can go take them to the grocery store, you can kind of go about your everyday business, despite the temper tantrums, then it's probably within the normal range. If it feels like your whole life is revolving around these temper tantrums and you're not quite sure how to handle it, that's when you want to get a mental health provider involved.
Thank you. Next question. Does early untreated depression continue to progress to other mental health conditions? I'd like to take that one.
I can take that.
Okay, Dr. Julian.
It absolutely can. So we know that when people experience depression and don't get treatment, things can continue to spiral. I think being depressed for a really long time can be a really difficult experience. And so it kind of can make you more prone to having some other problems as well. There are certain things that kind of just are not related to depression that the risk wouldn't increase for, but things like anxiety would go hand in hand quite a bit. So I think it is really important to get treatment as early as you're able to. But even if you've waited a really long time, it's not too late.
So, and I think this is kind of on the same line. How do we parents distinguish between, well, no, a little different, maybe the question before. How do parents distinguish between normal adolescent angst that they'll grow out of a behavior that requires, or if they need therapy? So normal adolescence versus, I think my young person needs therapy. Dr. Julian, would you address that one as well?
Sure. I think my response here is similar to the one about
Yes.
a 6-year-old with tantrums. You're going to want to kind of look at whether it's getting in the way of them doing what they need to do. So if your teenager is not able to do their assignments at school, they're not showing up, they're not hanging out with their friends, they're not doing the things that you'd expect them to be able to do during that developmental period, that's when it's a problem. The other thing that I'll say is ask them. They may be able to tell you, I'm not happy the way things are. And you can kind of gently support them and help them to find ways to get help for that and know that these things are very treatable.
All right, thank you, Doctor. This question is being posed to the doctor or Liz. What do you think about marijuana being recreationally used by someone with a mental health condition? That's a loaded question, so I don't know.
Well, I think when you're thinking about brain development, somebody between the ages of 14 to 25, I mean, it's different. Somebody that age versus somebody in their 40s or 50s using a substance. Not that these substances are healthy for anybody, but the research has shown that it can actually have some changes in the ventricles, and it can increase the chances of developing schizophrenia over the course of a lifetime. So it does, particularly if there's psychosis involved, it can really exacerbate that. So I know Dr. Julian may have something else to add to that.
Liz, you summarized exactly what I was thinking. So I did just want to point out too, Kat just added in the chat that there's actually a live Q&A about potential links between heavy marijuana use and the onset of early psychosis on Facebook. So there's a link for that, where I'm guessing there will be people who are really expert in this area to answer those questions too.
Fantastic, thank you to you both. So I have a question I'm going to pose to Penny. With your experience with your son and the hospitalizations and doctors, I've got someone asking, how do you go about finding the right provider?
Once upon a time, we had more providers to choose from. So it is difficult today. I will say that even here in NAMI, we ask our participants who take the family-to-family class, if you have a doctor that you like, could you just throw it out there? And we've done that. So there's recommendations that way. Otherwise, it's difficult for sure. It's not your imagination. There are fewer to choose from. So I can't even answer that question because if it were me, which it actually was me for a while, my son is going to there's one clinic Huron Huron Valley. I'm not sure, but it's out on Stadium. So here's a clinic that takes patients that had at that time Medicare. And there were a couple psychiatrists there. They were taking patients. I mean, you may not have a choice. You may have to take what's there because there's so few of them. But if you don't like them, then yeah, that's a tough question today.
Yeah, it really is. It just requires a lot of due diligence in the phone and just calling around, seeing who's open, seeing who takes your insurance. If you don't have insurance, calling, if you live in Washtenaw County, taking advantage of Washtenaw Community Mental Health Services for youth as well as adults. So it is tough. I remember trying to find practitioners for my loved ones, and you know, you interview them, you go in, you just have to get the feel for how your loved one is responding to that person, or if they're, in other words, clicking with that doctor or provider. So there is no, I guess, perfect way to do that. It just takes a lot of time and it takes a lot of patience.
Yeah, another thing you could do is on our website, namiwcorg, we offer support groups that are just drop in. They're on Zoom right now. You could go there and post that question. I think that we are our best sources of getting our loved ones healthy again. I really think we have to take a very active role.
I think too, Penny, I would add to that. I mean, we do have, for community mental health, we do have the 24/7 line that people can call. That's 734-544-3050. And if someone's having a mental health crisis, or perhaps they are waiting to get in with a provider, many times there's a wait. They can, get help to help bridge them. So many times we have a team, a CARES team that is funded by the public safety and mental health millage, so that people can, many times they'll see people as a bridge to get them to their provider because they're usually on a waiting list. So there's that. And the other thing that I have noticed is there seems to be more opening up with telepsychiatry and teletherapy. So I wondered if that might help in the, as this is happening. So that was something that could open things up, is my hope.
Yeah, I would agree with that, Liz. In Psychology Today, there's a nice listing of providers that provide telehealth services. And I found that the way they list their providers, they give a bio and a lot of information. That was just one of the resources that I have used, Psychology Today. And I've also used Mental Health Web, MHWeb, I believe it's .org. But maybe someone can check that and put that in the chat as well for those who will get this resource afterwards. I'm going to do one more question. I think we have time for one more question. So this person is writing that their teenager was admitted to an inpatient hospital this month, and now they're currently doing an outpatient program. And they're having a very hard time finding a practitioner to work with their teenager once they leave I think it's the day treatment program, because no one seems to be taking new patients. How can we ensure that they get the care they need? We are especially worried about them going back to school without having supports in place. Liz, can you help on that one?
Yeah, so what you could do is you could call our crisis line and our access line and explain what's going on. And they can help bridge if there are medications prescribed. And they can also have somebody help create a crisis prevention plan until the person can get connected with a provider. And a lot of times I've noticed some of the partial programs, they sometimes do have providers, and before your youth is released from the partial program, you could ask if they could, write at least 1 month's supply of medications, so you're not in a rush, But again, if you do call our number with community mental health, we will be able to see the person that same week.
Fantastic. Excellent. Thank you, Liz. I said I was going to, that was the last one, but I'm going to add one more. How do we know that we've been correctly diagnosed? This person writes that their diagnoses, oh, wait 1 second. Oops, I lost it. I think they took it off. Well, we won't do that one. It looks like that was deleted. Okay. All right, I think that might be it. Did any of our panelists have anything else or final words that they'd like to add for tonight?
Judy, I think Kat just put the question in the chat.
Oh, okay, because I just lost it. All right. Oh, okay, great. Wonderful. Because I wanted to mention that one. How do we know that we are correctly diagnosed? My diagnoses changed so much over time. Then I was told I was misdiagnosed. So I guess I want to defer that to the doctor here. How do we know if we're correctly diagnosed? And do diagnoses change? And how do we navigate that? What does that all mean?
Yeah, so it can be super tricky because there are a lot of diagnoses that can be pretty similar. And so it's very possible that depending on your symptoms at different points, it might actually look more like one thing than another, and that might change over time. So I think what I would recommend is kind of asking your providers when they are giving you a diagnosis that's different than what you've heard before. Ask them, why is it not this thing that I thought I had? And they will probably be able to tell you a specific symptom or something that is telling them that it's this other thing instead. The other thing that I think I would keep in mind is the reason why diagnoses are important is because it leads to a treatment plan. And there are different diagnoses that lead to the same treatment plan. So it could be that the change in diagnosis isn't meaningful because it doesn't change anything. It just puts a different label on the same problem. So ask your providers about, if you're giving me this different diagnosis, does this change anything about the plan? And that will hopefully get you to a place where you feel like even if the name on it might not be 100% certain, you know what you should do about it.
Thank you. That's great. I noticed someone also just put, for an FYI, I had mentioned going to using Psychology Today. And I would agree with, thank you very much for one of the participants saying that oftentimes some of the resources are not so up to date. You've got providers coming in and out, taking this insurance at one time and not taking it later. So it's important, of course, to call and verify that they still are taking new patients and the site is updated. So because it always doesn't, it doesn't usually show the latest information. Another thing, the person also shared that they have Medicare insurance, and Medicare was able to give them a list of approved providers. So also look into whoever, if you've got insurance, check the list that your providers have for you to also find someone that can provide services to you. All right, anyone else want to add anything before we close this evening? Well, it looks like we can just kind of nothing. All right. I wanted to thank you all for joining us this evening and asking such great questions. This has been very stimulating. Also, a big thank you to our wonderful panelists this evening. If you're interested in learning more about the organizations behind this series, please visit their websites through the links in the chat. We will also be sending out, again, as I mentioned earlier, an email with the webinar recording, resources, and slides as soon as we're able. If you have any questions that were not answered during this webinar this evening, please email communications@namiwcorg. And with that, I want to thank you all and have a wonderful evening. Bye now.